Why are African Americans more likely diagnosed with schizophrenia and less?
Dr. Berry, licensed psychologist, and what the research has shown, this is something that they have looked into. And when a Black patient presents with psychotic symptoms, hearing voices, delusions, paranoia, behavioral health professionals tend to focus on those symptoms and not look for mood symptoms, trauma, other things that may be present. We also have to be mindful that if a Black male presents to therapy talking about fear of the police when they go out in public, they feel like people are looking at them, that is not paranoia. That is what it's like to be in a Black body. And that is where cultural awareness and cultural humility can honestly help lead somebody to a more accurate diagnosis. Clinicians can have bias, especially if they're not aware of their own racism. I hope that helps. With any mental health diagnosis, there are things that can predispose a person to developing a diagnosis. Being in a marginalized body and experiencing racism and trauma can trigger the expression of certain diagnoses. I also have a loved one that was diagnosed with this. I do believe it was either accurate or it's major depression with psychotic features. Medication has been extremely helpful in stabilizing this loved one. It was triggered by a traumatic event. If their treatment isn't going well, and if you suspect there might be depression or some other things going on, then an updated psychological with somebody that is culturally aware and culturally competent would be incredibly helpful. My concern is that with the same symptoms, a Black person is 2 times more likely to get that diagnosis than a mood disorder. So I haven't seen literature saying that bipolar disorder was overdiagnosed within Black women. What the research actually says is that Black people are actually diagnosed later with bipolar disorder, and it may go untreated. The thing that I've seen in clinical practice is that trauma can sometimes get misdiagnosed as bipolar disorder, and that's across ages and across gender and racial groups. That people with PTSD, borderline personality disorder, or like a cluster B type personality disorder may get misdiagnosed as bipolar when they actually have untreated trauma. That's what I've seen. Here are some tips for therapists that work with Black clients. One of the biggest things is doing your own work around being anti-racist, actively anti-racist. It's not enough to be not racist, and looking at privilege and then in all the other areas of privilege that you might have. I examine my own privilege around being heterosexual, cisgender. I work with LGBTQ clients, and I bring up and I do my own work, and I do trainings with LGBTQ clinicians that help educate me on things that my clients experience and different strategies I should know and different theories and things that I need to be aware of when I work with this population. And then I'm totally okay if my client prefers to work with somebody within their community. But doing your own work and referring out when necessary. Paying for consultation. So I will be honest, I haven't taken a look at the whole revised version of the DSM-5, and I'm really glad that you pointed this out because I hadn't seen it yet. Here's an overview of the cultural formation interview. It has 4 different domains, and it's something that can be used with all clients. It doesn't have to only be used with BIPOC clients. The goal of it is to understand the client's presenting issue from their perspective. I think clinicians doing this can help avoid the clinician interpreting something as problematic that might be normal within a person's culture. For example, the period of time that we allow for grief is a cultural thing. There are some cultures that say a minimum of a year. And trying to understand what the client is coming with, how is that viewed within their culture? And they give specific questions to do it. I'll put more thoughts over in the comments. This is one of my pet peeves with people that do assessments for kids that are in foster care or that have been adopted. The very nature of being in foster care or the very nature of being adopted, there is trauma there. And one of the first questions I would ask to kids that I worked with that were currently in the system or that had been in the system before was, how did you go into foster care, or what was the reason why, trying to understand how the child understood it, and then I would get an idea of the number of placements the person had had. And then I would request as many records as possible, including the court documents for why the child was removed from social services. That wasn't something that I was automatically given, and it wasn't something that the foster parent had. Understanding that child's story was essential to arriving to a more accurate diagnosis, and I stayed away from this diagnosis. Oppositional defiant disorder is in the disruptive impulse control and conduct disorders, and is characterized by angry/irritable mood, argumentative defiant behavior, or vindictiveness. And the thing that I despise about this disorder is that the kids that I've got that sometimes are displaying defiant behavior, it's often related to something else, including parenting, trauma, anxiety, or depression. So I have very rarely given out this diagnosis. I did in one particular case because I felt it was accurate for that individual who did not have a history of trauma or depression or anxiety or any of those other things. I do think parenting was a big factor in why the individual was acting the way they were, but it was a DJJ referral, and I did feel like that was accurate for that person. It's often overdiagnosed in Black males. So let's talk about standardized testing. The EPPP is the licensing exam that psychologists take. And if there was a question on it that the majority of psychologists got wrong, that question would not be included, despite the fact that if most clinicians were culturally aware, they would get it right. The APA has acknowledged there being significant racism and bias within the field of psychology. It just is. And it took until, I think it was 2021, for them to finally acknowledge it. The American Psychiatric Association, I believe they acknowledged it in 2020. But a question would not end up on the test that the majority of Black students or BIPOC students got correct, and the majority of students got incorrect. Phew.